With the cage they basically put in my back, the compression of all the discs isn't there anymore because it's a cage. And it solved the initial problem, but it doesn't slow down the problem with the rest of the back having issues. Once again, I'm struggling to walk around the job site just to look at the little bit of work that we had to do. And I was telling him about thinking about stem cells, and he said his son had gone through it, which is Greg Jr. He said he went great for him, he loves it. And I said, well, pass me on the information. And it was really weird that as I'm looking up stem cell doctors in the area, and it happens to be the same doctor that Greg Duffy had recommended to be at the same time, I'm like, this is karma, something's going on, you know? So that's when I ended up reaching out to Dr. Mark, and because I haven't even reached out to anyone prior to that. It was just kind of, when both of them added up, I was like, let's try it. My name's Keith, and basically I'm looking to just get more relief and be able to feel like I can do the activities that I used to do that I haven't done for quite some time. So, and basically I had back issues for quite a while. 2012, 2013, I was locking up sometimes where I couldn't even just get out of bed or get up, get into a certain position. I couldn't get out of it without, and I went twice to the hospital to get I guess they put morphine or something in my back. I don't know, whatever. And then I'm good for a few months. And then after about 2015, I was having issues again. I went to see my regular primary care physician. She said, look, we don't want to send you for an MRI. You need to go see a physical therapist. So I went to the physical therapist, did that for like 2 minutes. I was in the physical therapist's office, and they said, there's nothing I can do for you. You have what's called drop foot. And it was in my left foot, and I couldn't pick my toes up. Physical therapist said I needed a surgeon. So I went and did my research to figure out a surgeon I want to talk to friends, went online, did different things to figure out a surgeon. Found a really good surgeon, very happy with him. Took care of the surgery in 2015. Within 3 months of recovery, I had drop foot on the right side. So we went back in. During my first surgery, they did a fusion and did a disc replacement. During recovery, had drop foot on the right side, went back in, did another surgery, fused it all together, so now just what cage in the L3, L4 section. Since that surgery, I've had numbness in my feet, like neuropathy type thing. And I just, because of going into the back with the surgery, nerves can get damaged, I guess. He explained all that to me, and I'm like, maybe it comes back, maybe it don't. Well, now we're 2025, and I've been steadily having the same issue, but with no real relief with cortisone shots, which I've done multiple times. Just looking for other options. As you realize, everything you've been doing up to this point hasn't been working. And, going around and watch older people that look 15, 20 years older than me, getting around better than I do, kind of makes you go, there's got to be something better, And every doctor I talk to, whether it be my primary care or anyone that's seen my x-rays or MRIs, they go, oh, your back's just a mess. So now that L3 and L4's caged in, it just means I'm going to go back for surgery for my, the next disc up or the next disc down, and it's just going to become a constant surgery thing, and I don't want to go for that. I like to do activities with friends and, drink my beer and play some cornhole, but playing cornhole's gotten difficult, so it's, bending over to pick up the bean bags to throw them across the table. Standing upright's not a problem, but going over to get the bags has become an issue, and I just think quality of life is important to me, so. And I'm just looking at other options at this point.